Today we discuss the topic related with the disease of infancy and childhood. So we discuss the respiratory disease of the newborns. Now, so they also have some parameters. We also going to know about the some about the fetal lung anatomy, and also the along with the histology of the fetal lung. So this is early development, embryologically development of the lung. So this is also a fetal lung development. Now this is a fetal lung development. Now the fetal lung histology. So initially a part related with the anatomical, there the pharynx and the larynx and the trachea, and then both lungs, and along with the lobes, and they also divided in the nodules, and with the histologically containing bronchioles, terminal bronchiole, and the respiratory alveolar spaces. Now the disease and that also can be occur within the respiratory system in the newborns. So containing the respiratory distress, they also can occur at the birth in the newborn babies. So this is also a respiratory distress that also can occur within the newborn baby. It is also a transient tachypnea of the newborn babies. So this is also a surfactant deficiency. So there's the pneumocyte cells type 1, type 2, and they also having their can cause the deficiency of the surfactant. So they also can causing there the acute respiratory distress syndrome. So other condition they also can be related with the respiratory distress and occur in the newborns. There is the meconium aspiration syndrome, another one, and there is the pneumonia oblique sepsis and septicemia also can occur, and there is the pneumothorax, accumulation of the air and within the lung spaces, and all the other air leak, and within the they also can leading to the accumulation of the air and within the thoracic cavity. Now respiratory distress that also can occur in the newborns. So it is also containing the respiratory causes. They also can be implicated in the pathogenesis of the respiratory distress syndrome. That also can occur in the newborn babies. So they also can containing the congenital abnormalities of the of the lung. Most probably there is the trachea. So the other conditions they also can contributing in the pathogenesis of the respiratory distress. There is the congenital heart diseases. Congenital heart disease at a spectrum of the congenital heart disease contributing, and there is the right to left shunt and the left right shunt. So left right shunt, and they also having comprising there the ASD, atrial defect, ventricular defect, patent ductus arteriosus. So the from right to left shunt, shunting of the blood, and from the right side to the left side, they also can comprising there is the tetralogy of Felder, transposition of the blood vessels, and then the truncus arteriosus. So these are the condition they also can contributing. They also can be in the congenital heart diseases. So the other conditions, other condition they also can be contributing in the respiratory stress. There's a developmental. There's also having a diaphragmatic hernia. So this is also a congenital diaphragmatic hernia. So the other causes are like the congenital cystic adenomatoid malformations. So these are the some other rare lesions. So they are also having the tracheal amyloiditis. They also can be aspiration. So the other condition, there is the esophageal abnormalities. There they cause the most probably there is the esophageal atresia. So they also can be, and there is pulmonary hypertension, persistent pulmonary hypertension in the newborns. So these are the list of the respiratory causes that also can be occur in the respiratory distress syndrome. They also can occur in the newborn babies. Now, so the other, how we can diagnose a case of the respiratory distress syndrome as in the newborn. We also can knowing about the maternal. There are also the maternal history. So containing there is the any most of any risk factor comprising, and there is the gestational most probably there is having there is gestational at the age of the infant. So other causes, and there is the amniotic fluid. Amniotic fluid, we also can see the color, odor, and the volume of the amniotic fluid. Other like intimating, and they're also having the enteroportum. Enteroportum, most probably there is the enteroportal history. So they're also very important, and some other conditions. There are also having the clinical presentations, clinical presentation and assessment. So these are the some contributing factor, X-rays and laboratory findings, evolutions, and they are also can be helpful and to reach the appropriate diagnosis. So the respiratory assessment. So respiratory assessment, we also can be respiratory rate. What is the respiratory rate? And whether they are we also can be see the quality of the some there the quality of the inspiration, expiration, so also breath. Quality of the breath, whether they are the shallow or the deep breath, are also the some there some persons, some baby there who are having the nasal flaring and the grunting, and also the some there the retraction, और उसके बाद other like the breath sounds. So then after we also can be some of the clinical presentation of a newborn, that also can be related with the respiratory distress. So there is color we also can be they also can appear in the there is the pink in color, and also the dusky, and most probably there also a pale in color, and also having there the okay, ठीक है. तो ये noticed most probably you also can see the color of the whether they are the pink in color, breath sound dusky हो जाता है. उसके बाद they also appear in the pale in color. So some there the central, most probably the peripherally location, and also there the heart rate, most probably heart rate, whether they also we also can see the heart rate, and also the pulses most probably, and showing there the distal versus central, and also some there the otherwise like the perfusion pressure. So these are the some parameter, and we also can be showing in the case of the respiratory distress of the newborn babies. Now these are the other clinical presentations. So also can first of all physical presentation. There are also having the physical characteristic features in case of this. So first of all, we also can showing that the flat nasal bridge, and they are also having there the most probably the salmon creases, these salmon creases, and they are also having there present in the Down syndrome. So the other condition like the recessed, and they also recessed chin and low. So these are the some physical appearances of a case of the respiratory distress syndrome in patients. So they are showing the low set ears, So these are the some feature presenting in a patient of the respiratory distress syndrome and the newborn babies. Some there are showing deformities like the some there extra digits and polydactyly, They also can call polygonally under the gastroschisis. So these are the some imperforated anus. So these are the some developmental deformities, and also some other muscular deformities like some there are the hypotonia and versus hypertonia. So they also can show whether they are the hypertonic and then the hypotonic skeletal abnormalities, and they also can showing some there the coanal atresia, some there the osteogenesis imperfecta. So imperfecta. So this is also a so this is also disorders, and they also can showing in the most probably in the autosomal dominant disorders. So others like some there the scaphoid. Most probably there are some presents the scaphoid abdomen. We also can see some there the other physical appearances in a patient of the respiratory stress. The abdomen become the scaphoid in appearances. Okay, so there is so then after we also can showing there the X-ray abnormal X-ray findings in a case of the respiratory stress. First of all, there is the structure we also can see in the X-ray. They also can see the ribs, and then the vertebrae, and also the liver, and also the some there the stomach and the intestine, other part of the intestine, and there's the lungs, and then after some heart shadow, and also the most probably the trachea, and then the esophagus. So these are the some organs, and they are a part of the body. And we also can be structures. They also can be seen with the help of the X-rays. So we also can be see other on X-rays. We also can see lungs. In lungs, and we also can see there is a lung volume, and they also having there is the expansion of the lung, whether they are the retraction or the expansion of the lung, and also the some there the some there the densities. We also can see densities, and whether they are the opaque shadow or also the some there the there's also having there the blackish in color, or also some there the whitish color, and then the appearance of the gases. And then after we also can see the whether the fluid accumulation, fluid, and also the whether the collapse of the lung. Fluid presentation है या कोई collapse of the lung है, but they will also can be showing, and with the there they will also can see the density with the help of the X-rays. So there are also having the free air, most probably is also a Gately, they also can be in dark in color. So dark in color, and there is some masses. Any abnormal mass, it also can be some tumor mass, or also some benign malignant tumor. We also can be seen in the case of the respiratory stress in the newborns. And also there's some there the heart shape. There are also heart shape. There also can be and the size of the heart. Whether they are the boot in shape and boot shape, and also there's some there abnormality. Some there the so these are and egg shape होती है यहाँ कोई oval and oval in shape. So this also having there the oval shape हो या egg shape हो, तो यहाँ कोई square shape या boot shape होती है. So they also can show the different abnormalities. So Leopard evolutions. Leopard evolution also can be seen in the case of the respiratory stress in the newborn. They are also helpful and for the diagnosis of the case of the respiratory stress in the newborns, like the ABG. First of all, complete blood count, and there is also there is differential count. So we also can see there the hemoglobin percentage, and also along with the erythrocyte sedimentation rate (ESR), and also the some there we also can see the WBC count and RBC and WBC count, and also along with the platelet. We also can show the along with the differential. There's a normal amount of the hemoglobin about the in the male. There are the 14 to 15 grams per percentage, and then after the in the female about the 12 to 14. So the APG, artificial gas, and the carbon dioxide, carbon gas. So the capillary blood gases, and the VBG, they also have venous blood gases. So they are showing the other the blood culture. We are so showing the for the isolation of the different microorganisms. We are also doing for the blood culture, and then the CRP. So they are also having the electrolytes. Electrolytes are also with the help of the they are also showing the sodium level and also potassium level and the some the chloride level. So there are also having the type. Okay, so these are the some helpful and PQ, and these are the some lab body investigation. They are also can be little helpful for to reach the appropriate diagnosis at the respiratory distress number. So this is also a respiratory distress. There's also for the detection of the differential most probably diagnosis. So different diagnosis they are also having there. We also going to be doing for history of the newborn baby is very important. And also some there the presentational. Also the presentation most probably they are also having there the and the clinical assessment of the person and X-rays and lab investigations. So these are the parameters that are also can be helpful for the they are also can be detected for the to reach the differential diagnosis of the respiratory distress syndrome. So it is also a transient. Most probably there is a transient tachypnea occur in the tachypnea. There's also tachypnea of the newborn babies. So it is also a most common, diagnosis of the it's the most common diagnosis of the respiratory tract disorders in the occur in the newborn babies. So they're also having there the remember often. They also remember often and from also the term there is the infants means a little early. Okay. So they are showing there is some there the transient tachypnea. They also can occur in the newborn. There also can be diagnosis with the help of the history. Clinical history is very important, and they are also having there the common. Most probably they also commonly and associated with the cesarean section of the delivery, and this condition they also can occur the time of the C-section and the delivery. So they are also having there the uh, mentally most probably there is a maternal analgesia at the time of the surgery. So they are having there the anesthesia complication. So there is the maternal anesthesia. So these are the some anesthesia they also can be given during the most probably there is the labor time. So these are some parameters they also can be helpful to other. They also can contribute in the risk factor. And maternal, most probably there is a maternal asthma, very contributing in diabetes mellitus, asthma, also the some there is the breathing disorders, and also there is the perinatal, most probably there is perinatal asphyxia, and also the some there is the uh, prolapse cord, umbilical cord. So these are the some risk factors that are contributing for the transient tachypnea in the newborns. Most importantly, okay, some there the they are also common associating with the cesarean section and also the delivery time, and there's the maternal analgesia and also the maternal anesthesia complete during the labor. So they also can give some there the maternal fluid accumulation. Most probably there is the fluid administration जब हम fluid देते हैं, and they also can be causing some there is also a maternal most probably asthma, diabetes mellitus, and some brain tendency. They also can be contributing and for the causing the transient tachypnea in the newborn. So prolong, there is a prolapsed cord. So the other most probably there is also the transient tachypnea of the newborns. So some there is respiratory assessment. How we can assess the case of the by the respiratory examination. Some there is the tachypnea. They are most probably there is the 60 breath per minute. There is the 60 to 150 breath per minute. So this also can be occur. There is a very harsh. So there's also nasal flaring. We also can see some the nasal flaring, grunting, and also the some that the retraction, and also the other we also can be there is a fine most probably there's rails and the calculation of the rails, and also some there is a cyanotic whether the cyanotic persons and also can be occur. So this type of the some there is a respiratory condition. They also can be a symptom, also can be sign. We also can be mere at the time of the examination. In a case of the transient tachypnea of the newborns. So the transient tachypnea of the newborn. So some there is the other we also can diagnosis with the help of the X-ray finding. There are also having there is the first of all, they also can show in a prominent and there is a uh, perihilar structures. We also can see from perihilar structures. Some there is the hyperinflation. So the increased number of the air gas can be hyperinflation of the lung. So on the chest X-rays. So some there is fluid they also accumulated and within the fissures. So these are the some parameter we also can be see in the chest X-rays are the findings. Laboratory finding also can see there is a CBC complete blood count and with the there also with the normal with the normal most probably the limits uh, APG and also CBG. So these are the also can be showing whether they are the some showing there is a mild and to moderate. Also can show the mild to moderate and hypercapnia. So we also can see that the mild to moderate hypercapnia and the hypoxemia. So and they also can be associating with this and with there is with the respiratory acidosis. So persons and who also can be with the transient tachypnea, we also can diagnose a case of the there is a respiratory distress by the help of the labs. So they are also having there is the ABG. So in the CBG, they also can be showing so the mild to moderate, mild to hypercapnia, and there is the hypoxemias, and they also can be seen and with the respiratory acidosis. So this is also a case of the transient tachypnea. We want chest X-rays. They also having there the hyperinflation of lung and there is prehilar prominent prehilar structures. Now, so how do you know about the most probably now this is also surfactant deficiency. They are also a most important cause and for the respiratory stress. It is also most it's one of the it's also one of the most probably it is one of the most common the most common cause of the most common problem. They also can occur in newborn. So they also can be associated and with they also can be associated and with a premature most probably they also can associate premature infants. So surface deficiency, the deficiency of the pneumocyte type 1, type 2 cells. So they also are associated with the premature infants. So in this condition, there is also a decreased surfactant production. Surfactant production by the help of the pneumocyte cell also can occur within the lungs. Within the lungs of the there is preterm babies, preterm infants. So in this condition, there is whether there is a decreased, there is most probably there is a surfactant decreased surfactant production. Okay, so they also can occur in the preterm infants. So there is the respiratory distress syndrome. How we can diagnose by the clinically, first of all, there are also there is the gestational age. They also can be less than 38 weeks. This condition also can occur at the time of the gestation age of the less than 38 week के दौरान हो सकता है. उसके साथ there are also having there the prenatal most probably care, prenatal care, and also some there the diabetes mellitus. They also can be diabetic mellitus. It's also controlled diabetes, controlled and versus uncontrolled. So these are the some conditions. They are also helpful and further for they also can be implicated in the pathogenesis of the respiratory distress syndrome. Uh, Perinatal infections, they are also having the infection. They can also contributing, and some there the problems they also can occur and during the pregnancy. So they also can occur and at the time of delivery. So like the first of all, there is the asphyxia, and also the some there is stress to fetus. So these are the some conditions. There is the hypothyroidism, and some there is multiple organ involvement, multiple births. So these are the some conditions. They also can be helpful or the contributing in the clinical history of the respiratory syndrome. Okay. Now we can diagnose a case of the respiratory distress present. There the presentation. First of all, there also having the respiratory assessment. How we can die. First of all, there the tachypnea. There also more than 60 breaths per minute. In the case of the self-efficiency, nasal flaring, and also the some grunting and rates also having there the retraction, retracting, and also the some there the apneas, and also the some there the apnea and irregular, and some there the respiratory there are also patterns. Other like the rails, like the most probably there is the crackling sound. Rails there also have some there the crackling. There are some feature there cracks. So there are also the diminishes most probably the breathing, diminished breath sounds, and also there is also the cyanosis. So these are the some features. There's a courtesy feature. They also can be assessed by the respiratory examination. So they are helpful in the diagnosis of the case of the respiratory syndrome. Now, X-ray finding in the respiratory syndrome. First of all, there is a loss of the volume. There is also loss of the lung volume. Lung volume का loss हो जाएगा. इस तरह से tidal volume. So these other volume, there is also loss of the volume, respiratory volume, and also some there is a reticulogranular. Most probably there is a pattern, reticulogranular pattern, and or the some there is a ground glass appearance. Ground glass appearance होती है. उसके बाद there is the air also can be air bronchograms. They also can be done, and also other there is bell shape. So also has other there is air leaks, and they also can be occur. The loss of the hard border, जो लीची होते हैं hard border, they also can become lost, and some there the atelectasis. Atelectasis there the inability of lung, and they also can become the expand, and also the white out. They also can appear the white in color. पूरे का पूरा शरीर जो whitish हो जाएगा. So this is also a X-ray finding in case of the respiratory distress syndrome. You have also can be seen in this picture. So this is also a case of respiratory distress syndrome. How we can dial lab body finding, lab body result, and most probably there is the ABG and the CBG also can be some there the hypoxia, there is the hypercapnia, there is acidosis. So the other CBC, and there's the differential leukocyte count. So the now there is the treatment, and for the most probably respiratory syndrome. First of all, we also can be post there is exogenous surfactant therapy also can be given. Some there the many on the most probably there's many on the there is the market also can be available. Prophylactically, we also can be given for the treatment for surfactant, and there is the administered. How we can this is also a meconium associated some there the syndrome. They also can be causing meconium. They also can cause the respiratory distress syndrome. It's the most important cause. History examination. So like this same maternal diabetes, they also can be contributing. Some that the pregnancy, most probably pregnancy problems, pregnancy induced, most probably there they induced hypertension, and they also can be this condition. They also can contributing in the passage of meconium associated distress syndrome. Other condition like pregnancy complications, some the problem they also can occur, and during the some the pregnancy or at the time of the delivery, so they also can be contributing, and there the decreased most probably there is the decreased bass sounds. Meconium associated aspiration syndrome. So this is a clinical presentation assessment. How we can diagnose a case of the meconium aspiration syndrome. So just you can see the color of the meconium, whether they are also appear in the pale in color and also the green color. So the different color they become the cyanosis, and there they also some then the still scan. Now this is also X-ray finding in the case of the meconium aspiration syndrome. So this is also a pneumonia or the sepsis. They also can occur in the newborn babies. It is also most common. They also can be occurring frequently. They also can occur frequently. They also can occur in the newborn babies. They also can contributing three types of the pneumonia. They also can occur with pneumonia within the newborn babies. First of all, canine pneumonias. Also there is the intrapartum pneumonia, and also some there is the postpartum pneumonias, and also this is also most often they also can be associated. Most often they also can be seen and with postcentral pneumonias. So this is also most often, and they also can be seen and with they also can be seen with the most probably the core amniotic this also can be associated with the core amniotic. There also can be occur premature, and most probably the premature, and also the some the uh, now this is also some other some there the it also can occur frequently. It also can occur in the so the most important causes of the pneumonia. Some there the There is premature, most probably prematurity. So there are having there the first of all there is the prolonged rupture of the most probably the prolonged rupture of the membranes, and also the other like the maternal there is the maternal temperature is also more than the 38 degrees centigrade, and also the foul simmering amniotic fluid. So these are the some causes they also can be contributing in the pathogens of a development of the pneumonia in the newborn babies. So they are also having then the there are also having then the non reassurance, most probably there is the stress. So these are the some other causes like the fetal tachypnea. So fetal tachycardia, there are tachycardia, there is the meconium associated, and they also develop the pneumonias. Some there the maternal history or the there is the maternal history of the sexual transmitted diseases. So the respiratory assessment, how you can assess the case of the pneumonia in the newborn, the help of the respiratory assessment clinical examination. So they also can showing there the there is a tachypnea, and some there the apneas, and also them there the regular breath sounds, regular breath pattern. That's also contributing, and also there the grunting and the retractions, and also nasal flaring, and also the some there the okay. So these are the some there the we can assess the help of the. There are also having there the colorful, most probably there the secretions also can present in this condition. There are the rails, and also the there the crackling sound. In this there the ronca will also can be present. Okay, cyanosis, ronca they also can be present in the pneumonia cases. Now clinical presentation. So they also can appear in the gray, most probably gray pale in color, lab finding, and also can occur. There are also now some there pneumonia. Pneumonia they also can be sepsis. This is also a case of the pneumonia. There the become the consolidation of the lung. X-ray finding in a case of the pneumonia. First of all, there is a patchy distribution, patch infiltration. We also can be seen. Then there is the aspiration of the aspiration pneumonia. So bilateral. There is also a diffuse pattern. They also can be showing. There is a granular patchy granular pattern. They also can be seen on the HS X-rays. Some there is the streaky appearances, and some there is the loss of the volume in case of the pneumonias. So some there are the densities also are present over here. Shadow become lung become collapsed. So this is also case of the pneumonia or the sepsis in case of the respiratory distress. So some there the pneumonia like the we also going to history and the clinical examination and the laboratory investigations and the X-rays are also helpful and for to the appropriate diagnosis. So this is a pneumonia. There is a pulmonary, most probably there is the air leaks, and pneumothorax also can occur. Hemocirculation of the air with the thoracic cavity. There also are some there is the respiratory assessment. How we can diagnose a case of the pneumothorax or the air leaks. We also have some. We also can see the trachepneic person, a baby, is also tachypnea showing, and there's a nasal flaring and the grunting. There's the attrition, and also the other like the clinical examination of the case of the pneumothorax. First of all, persons also come cyanotic, and also the some appearance of the paler and green appearance. So there the heart rate, they also can be made heart rate, and also the some there the become the tachycardia, tachycardia, and some there, and also the bradycardia, they also can be showing in these cases. So this is also a pneumonial sepsis. This is a pneumothorax. So just for having the pneumothorax, accumulation of the air within the thoracic cavity. So they also having their right, most probably lateral, right lateral. There the decubitus, and they also can showing there the view of the X-rays. Now the some there the most probably congenital heart, there they also abnormalities in the lung. Some the congenital heart, most probably there the congenital heart diseases. So other diseases are like the congenital diaphragmatic hernias, and also other like the congenital there is the cyanotic, there is the congenital cystic endomatoid disease and Memon associated. So there is some other malformations like tracheal abnormalities, and other like the esophageal abnormalities like atresias, and there is also a pulmonary hypertension in the newborns. So this is also a congenital heart disease. Congenital heart disease is very important. They also occur in the congenital heart disease in the newborn. They also can occur. There's a group of the disorders. They also can defect presenting at the birth, and birth they also can often they are also having there the often picked up to the they also can be often picked up to the early age, early there also can be occur ultrastructurally. So this is a group of the heart and heart disease like some there the increased in key, most probably there is risk. Number one, first of all, there is increased parents, and they will also having there is renal heart disease पहले से हो चुकी हो, and then after, so they are also having there is still most probably there is a siblings, and they will also having there is the renal heart disease. So these are most common risk factor for development, and there is the maternal diabetes mellitus, and for the development of the renal heart disease. So these are the some there are the common causes, and they are also contributing, and some there the alcohol, most probably alcohol use. There the fetal alcohol syndrome. There also can development of the kind of heart disease. So and also the other cocaine. Some people have also can be cocaine use, and they also can develop the during the pregnancy, and they also can developing the this type of the conditions: cocaine, alcohol, smoking, and other like the infection, diabetes mellitus. They can contributing in the pathogenesis of the uh, kind of heart disease. Group of the heart disease. First of all, there is the right to left shunt, left right to left shunt, and the left right. So left right shunt, there is going to be patent arteriosus, and also the atrial septal defect, ventricular defect, and from right to left, tetralogy of failure transposition of the blood vessels, truncus trachea. So these are the four important group T4. They also contributing in the heart disease. So we also termed as the acyanotic and cyanotic. Acyanotic contributing like the patent atrocial defect, ventricular defect, and cerebral disease. They also can contributing Fetal failure, transmission cerebral vessels, and truncus arteriosus, trachus atresia. So these are the four they associated with cyanotic heart disease. Two types of the kind of heart disease. Number one, they are the cyanotic, and they are also can be most probably they are the returning returning to the most probably the right side of the heart. वही सेम मैंने आप बताया था आपको जो right side of the heart, and there also can be paused, and through the there also can be this also can blood also can pass through the lungs, and they also can usually, and they also can be defect occur within the defect occur within the heart wall, and there's a heart wall, and they also can be. So these are the group of disorders. Clinical assessment and how we can heart rate we also can we see. So heart rate and observe, and there are also having there the heart become showing the slow fast. So they are also having there the variable, and other feature we also can be showing. So they are also having there the abnormal heart sound murmur. They also can be contributing from there is regurgitation, stenosis. Blood pressure is very important. Laboratory investigation and the labs and tests, and also can there ABG, most probably ABG. So there also can be showing, and there also a decreased, most probably there the uptake of the most probably other like the some there the lactic acidosis. Okay, some there checks exchange also can showing some there the and heart most probably there the and heart shoe shape. Echocardiography and ECG is very important, and for which type of diagnosis. So this is also congenital heart disease. Okay. We also can be done the common clinical features and also some important causes associated with respiratory distress. They also can occur in the newborn babies, like the transient tachypnea occur in the newborns, and the surfactant deficiency, and also the meconium aspiration syndrome, and also the canal heart disease. So these are respiratory distress syndrome. So these are the most important meconium aspiration syndrome, and also the canal heart disease. They also can and pneumonia. There are also kind of pneumonias, there's the intraportal pneumonias, and there are the postportal pneumonias. They also can be occur at the time of the birth. So the other causes like the kind of heart disease, the acyanotic and the cyanotic heart disease contributing and for causing the respiratory distress. And pneumothorax, accumulation of air within the thoracic cavity, and they also can be contributing in the pathogenesis of the respiratory syndrome. So this is all of about the respiratory distress, and respiratory diseases occur in the newborn babies. They also can be contributing. Most importantly, uh, group of the disorders they also can cause in the respiratory distress in the time of the gestation period. Okay. No, any question, beta? Salim? अलग से